An acquired brain injury is defined as damage to the brain which occurs after birth and is not related to congenital or degenerative disease. These impairments may be temporary or permanent and can cause partial or functional disability. Some acquired brain injuries can be a result from a car accident, a fall, or stroke, however, are not limited to just these factors. It is important to understand that no one case of acquired brain injury is the same as the other, as some may have a traumatic brain injury and others may have a non-traumatic brain injury. Generally, students with severe injuries are unable to attend school, and some require homeschooling until they recover enough to travel and attend classes with other students. As a teacher, it is important to know how the brain functions, especially when dealing with a student with an ABI. In many cases, it may not be evident from day one that the student has an ABI. The effect of ABI may take time to appear, and sometimes this can even take up to several years, especially for students in their teens. Often, ABI harms basic cognitive abilities such as memory, learning, attention and concentration, word finding, and visual perception. An individual with ABI will display difficulties understanding and processing information. This individual may become disruptive or have an aggressive behavior, which will result in poor results in school. Some common features of students with ABI may be that they are easily distracted, they have a short-term attention span, they fail to meet deadlines, have a consistent lack of effort, and inconsistent achievements. Individuals with ABI may experience easily forgotten things and have major difficulties with organization skills. Another common difficulty an individual with ABI may face is a lack of social support. These individuals may have difficulty keeping up with communicating with others and responding to others. In order to effectively teach and appropriately support students with an ABI, many different support members may be needed. In most cases, physicians or in hospitals or family doctors diagnose individuals with an ABI. Traditional educational assessment boundaries do not assess the cognitive and behavioral outcomes of an ABI. Specialized assessment by a neurologist is essential in understanding the profile of a student with an ABI. The neurologist has specialized training in evaluating thinking and behavior and can provide important information about the impact of ABI on cognitive, academic, emotional, and social and behavioral skills. In order to ensure you as a teacher of a student with an ABI is getting all the help they need, there are various accommodations or modifications you are able to do in your classroom and with students. The most important factor to ensure is present in your classroom is structure. Students with ABI require high level of structure in order to be able to academically succeed. Maintaining routine in your classroom allows an ABI student to have a sense of consistency and may feel as if they know where they are. Where possible, avoid putting students with an ABI in high-pressure situations. Some modifications you can do in your classroom: you can begin by trying to find ways to cut down distractions for the students, perhaps by finding a quiet room or working on getting the students' direct attention. Also, as a teacher, it is important to break down information into smaller chunks, as it is easier for a student with an ABI to process small chunks of information at a time. It is also very important to allow students to show their understandings. Ask questions where it is appropriate. Most students with an ABI may require additional time to complete a task as a teacher accommodating these students, this time can help them academically. Additionally, additional accommodations or modifications that may help these students by providing them with technology to aid memory, multiple formations of information, breaks and downtime, and tests or simpler ways to allow the student to express their knowledge. Where possible, seek for extra support for the student, as one-on-one support helps the student's understanding. Although it may be challenging to develop an IEP for a student with an ABI, it is important you frequently update these IEPs and you are flexible with the needs of the student. Take the time to collaboratively create an IEP for these students with the help of teachers, special education teachers, parents, and students if appropriate. In some cases, planning involves others. Because students with an ABI may continue to recover for months, if not years, it is important to review and modify the IEP on a regular basis. Take the time to celebrate and acknowledge the students' achievements throughout the year, and remember, with your help in the classroom, children are able to succeed regardless of their exceptionality.